So looking at the next neurological issue, which we'll be discussing this morning, this is what is known as cerebral palsy. All right. So once you hear cerebral, your mind will always go to the brain. All right. So cerebral palsy, we'll just have the brief introduction to this as possible. So it's not actually one disease. It's different types. So only a type can affect you. Do you understand? So it's just a group of neurological disorders. It affects how you move, muscle tone, posture. Do you understand? Can affect how a child walks. Affects how your muscle. Your muscle can be too flaccid, can be too rigid. So it's caused by damage to the developing brain, usually before birth. It can also occur during birth or when you are still a baby. So causes: prenatal brain damage. This one is like inside the stomach. All right. Infection, stroke. Maybe the baby oxygen was not reaching the baby well. Birth complications: premature birth, low birth weight, or difficulties delivering. Right? Maybe when you're passing through the birth canal, all those complications. Injuries to nerves and all of that, blood vessels. Postnatal factors like the child had a head injury, brain infections like meningitis or encephalitis. Okay, so for what we got for the symptoms, motor issues, so the baby can be stiff or floppy, depends. You can be too rigid, you can be too soft. Poor coordination, tremors. This is why this baby can actually walk on their own. It has to be supported. All right. Then developmental delays. All right. So you have issues trying to talk, trying to sit like your mates, walk. All right. When your mates start walking. Speech and eating difficulties. You have trouble speaking, trouble swallowing, drawing of saliva. So other signs: babies could have seizures, have vision issues, have hearing problems. So these are the different types here. You can pause here to look at it. All right. So we have the spastic, we have the dyskinetic. Spastic is you have stiff muscles. All right. Dyskinetic, you have problems moving. All right. Ataxic, you can't actually maintain your balance. Mixed, where you have a mixture of those symptoms. So treatment is just physical and occupational therapy, speech therapy so that the baby can start talking well. Medications if the baby is actually having all those stiff muscles, or joint issues, Assisted devices like walkers. This is a walker. You can use wheelchairs. Then communication aids.